Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right. I am John Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
Chilly, Willy. It's cold. My goodness. Yes, thank you for joining us this morning indeed. But yes, it is cold outside, somewhere around, 57, 58 degrees Fahrenheit along the coast.
Well, we got our forecasters to give
Yes.
us all those details. We got Crystal Rosales on the line. Good morning.
Hi, Crystal.
Morning.
How are you?
A bit cold.
Okay, I'm not alone. Great.
Yeah, we're not alone. We're not alone. But let's jump on into it. Tell us about the general situation. What should we expect?
Cool and dry conditions prevail over the country.
All right, that's good news. In the 24-hour forecast?
It's going to be variably cloudy, cool and dry, continuing today and tonight.
All right, the winds?
The winds will be from the north to northwest at 5 to 15 knots.
Which produce a moderate seasonal.
Yes.
All right, so let's jump on into the temperatures, man. Ooh, tell us about it. Highs and lows.
Well, today is going to be 78 along the coast and inland, and then 68 in the hills. And then tonight will be 68 along the coast, 60 inland, and 55 in the hills.
Oh, goodness. So if we're feeling this now, what's going on in the Balderbeacon area?
Right now, Balderbeacon is at about 50. However, the north is slightly lower.
The north?
Yeah,
At
in the
how much?
north, they're getting temperatures of about 47 to 49.
Ooh. Okay.
All right.
Yeah. So you're talking Corozal or all the way in Corozal?
Yeah, Corozal or
Orange
Indrock.
Rock? Okay.
Oh, my gosh.
All right.
I
I'll
know.
take our 59 then
yeah.
that we had this morning.
I'll rock the 59. I'm good with that. And, of course, in the extended forecast.
Generally fair and dry conditions are expected for Thursday and Thursday night.
So we feel the same way?
Yeah, it's going to be relatively the same going into the week.
Oh. Well, Crystal, thank you.
You're welcome.
Do enjoy your day.
You too.
All right. Bye.
Oh, wow. Mar, what is there to say? Corozal or Indrock?
49 at the moment.
48,
So yeah,
49.
if you feel exceptionally cold and you're in the north right now, you
Yeah.
are right. I wasn't expecting that one.
I
We
wasn't.
usually expect the hills to
In the
have
hills.
the coldest.
Yeah. I was thinking about it this morning. I was like, man, I wonder what our security forces are feeling up in the hills, up in Balderbeacon area.
Now you have to check on your friends in the north.
Yeah.
It doesn't matter what type of cold weather you've been exposed to before. It just always feels different in Belize when
It
that
does.
breeze hits and your house isn't insulated.
Well, all the buses from the north will be coming with jackets.
But it's nice. It is nice, and thankfully we don't have the showers that go along with cold fronts at times. So let's just enjoy it, bundle up, and it's going to be a few days.
You're totally right. Bundle up, but let's do it within our family. We don't want to be going anywhere else besides being right there at home with the entire family. Remember, we're still plagued with COVID-19, and we want for everybody to adhere to all the protocols set to us by our authorities. All right? All right.
So we're going to keep things moving?
Yes, ma'am. Let's move it. Let's move on now into our eye opener.
Okay. And our eye opener taken from dailyom.com goes like this. When making big change in our lives, it can be easier to break it up into a few small changes to avoid overwhelm. When we decide that it's time for big changes in our lives, it is wise to ease into them by starting small. Small changes allow us to grow into a new habit and make it a permanent part of our lives, whereas sudden changes may cause a sense of failure that makes it difficult to go on, and we are more likely to revert to our old ways. Life doesn't always give us the opportunity to anticipate or prepare for a big change, and we may find ourselves overwhelmed by what is in front of us. By choosing one thing to work on at a time, we focus our attention on something manageable, and eventually, we will look up to see that we have accomplished quite a bit. Forcing change is, in essence, a sign that we do not trust the universe's wisdom. Instead, we can listen to our inner guidance and make changes at a pace that is right for us, ensuring that we do so in alignment with the rhythm of
The universe. I'm loving it as per usual. It says a lot, and it gives a good insight into people, into things that for those who are feeling overwhelmed at this particular point because they've got something, a chunk of something that they might not see as a chunk and they're being overwhelmed by it. Look, the eye opener put it directly into perspective on how you could do it. There might be something big over there and that's where you want to go, but there's a long road to it. I'll give you a good example, Mar. A good example. I told you last week that I had planned to do the half marathon. It's 13 miles, 13.1 miles, and I thought about 13.1 miles at the start. But then I put into perspective, let me get to the airport road first, and from there to the Philip Goulson Highway, and from there on to probably Manatee Lookout. And those, you know, when I look at it from that perspective, I felt so good about it because then I know for a fact that I've conquered here. And my mindset was that, you know what? If I do from here to there, I will be able to make it. And I'll give another analogy. Back in the days of cutting your yard, big yard back then, big yard. You don't look at this yard and say, you know what, I'm going to cut the entire thing and just go one and that's it. You cut this section, you cut this section. By the time you look, hey, you're done. Exactly what the eye opener is saying. Put these things into perspective, and that feeling of overwhelm can tame down to a certain extent.
And for sure, you know, the examples you give, I think, is just being able to see the one step at a time, one step at a time process. And it's oftentimes very challenging when you have changes in your life to be able to break it down. And I think that's, for me, what the eye opener allows us to really think about.
Yeah.
It reminds me of people who are on weight loss journeys, people who decide January 1st, I'm going to stop eating X, Y, and Z. I'm going to exercise twice a day, and I'm going to drink, 10 cups of water, 12 cups of water a day.
Yeah.
They said so many different things. And it becomes so hard because all of these changes are coming at you at once. Sometimes you can be effective by just taking one off the list at a time.
Yep.
Get your water in. Get that first half hour exercise in and build up from there. And it's the same when you are overwhelmed with making any other big change. What do you need to accomplish and what are the steps that you need to take there? And figure out how you can go up that ladder, rung by rung, each race. What you talk about with using your markers for mile progression, but it can be done. I think fundamentally though, what we need to be reminded of at times is like, we gotta step back from that big picture and make sure we can put it all into perspective.
You're right.
And it makes it so much more achievable.
Yeah, family goals throughout the year 2021. This is my goal. This is where I expect to be for the first quarter, second quarter. So it's taking it into chunks and then making sure that you carry it out rather than look at all the way to month 12. So very, very good one for the morning there, Mark.
That's right.
All right, so we're moving on for the day. We'll be starting off our show this morning with 3 wonderful segments. Actually, we'll be starting off with a look at the update on COVID numbers and vaccines to be received in April. That's some good news.
Well, yeah. Well, what we're going to do is actually have a conversation, an extended conversation with representatives of the Ministry of Health. So we're going to be looking at the numbers for COVID. We're going to look at our progress so far and what lies ahead. And of course, that's our COVID-19 update for the day. The second part of our show, we're going to be talking about Scouts Month. The Scouts Association is celebrating this entire month. They have a theme, The Adventure Continues, celebrating 110 years of scouting in Belize.
And in our third segment for this morning, one of my favorite persons, man, Tim August will be joining us, and he'll be telling us about his famous Obia sauce, now available for purchase. This guy. So we're looking forward to it.
I hope he sent some breadfruit.
I know, that's his thing, breadfruit man. But yeah, so we're looking forward to all three segments, and we're about to take that break. But just before we do, we've got our birthday shout out, and we would like to say happy birthday to none other than Valentino Shal. Valentino, happy birthday to you, my brother. Here's wishing you all the best from your family, from us here at Channel 5, and from us right here on Open Your Eyes. All right, so we're about to take the break. When we come back, it's about the COVID update. Stay with us. We'll be right back.
Es un hecho que puedes obtener servicios ilimitados con Smart. ¿Cansado de que se corte la línea cuando más necesitas estar conectado? Es un hecho que cuando te suscribes al plan de Smart Plus, obtienes llamadas, textos y datos ilimitados. Y también es un hecho que te puedes suscribir con un grupo de 5 miembros al plan Smart Share y hasta 40 miembros al plan Smart Enterprise para llamadas, textos y datos ilimitados. Smart tiene los verdaderos planes ilimitados. Es un hecho. Sé Smart y vive de forma Smart.
Hola, Tony.
Hey, Kevin, ¿qué onda? ¿Qué pasa?
Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esta es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021 si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate, man.
Keeping safe from COVID-19 at your workplace requires 100% teamwork. You can keep earning while keeping yourself and others safe by doing some basic things. Wear a face mask at all times in the workplace unless you are alone in your own private space or office. Wash your hands frequently or utilize alcohol-based hand sanitizers and avoid touching your face. Disinfect surfaces like doorknobs, tables, desks, and handrails regularly. Increase ventilation by opening windows or adjusting air conditioning. Limit visitors and deliveries to the workplace and use appointments where possible. Attend meetings virtually as much as possible, and when not possible, hold meetings in open, well-ventilated spaces or rooms that allow for everyone to be 6 feet apart. Stay at home if you or a family member at home are feeling sick, or if you have been in contact with someone who tested positive for COVID-19. Keeping the workplace safe also requires that employees act responsibly when away from work. Practice social distancing and good hand-washing hygiene. Avoid large gatherings and avoid unnecessary exposure to others. Protecting others means protecting yourself. Together, we can defeat COVID.
In partnership with the British High Commission.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And welcome back to Open Your Eyes. We're moving now into our first segment. Update on COVID numbers. Once again, thanks to Full Tech System for providing us with this segment. COVID numbers, vaccines to be received in April. Now, this COVID-19, of course, once again brought to you by Full Tech Systems. In to talk to us about it, though, is Dr. Melissa Diaz-Musa, who is the Acting Director of Health Services, and also Lorena Perez, Surveillance Officer at the Ministry of Health. Good morning and welcome to both of you. We hope that you're feeling warm.
Morning, thank you. Thank you for having us.
All right, so let's jump on directly into this conversation. You know, the numbers for active cases for coronavirus in our country, they look promising. They look very promising, but we've been through this a few times, and whenever we feel this way, everybody seems to be you know, we've got that mentality that we could just relax now, man. We could take it light. It's only 200 and something. We came from 3,000 and something. What are the feeling like right now within the Ministry of Health? Let's start there. What's the feeling like?
Well, like you quite rightly said, we're happy with the numbers coming down, definitely. What we're mainly concerned about is that the general public get very relaxed, feel as if we have gotten over COVID-19 and it's no longer a threat. So we really want to remind the general public that even though things have been going well, the public health measures have been working and people have been taking on some responsibility, now is really not the time for us to give up on practicing these public health measures. Now is the time for us to ensure that we increase the measures, that we educate our friends and family, and that we protect our vulnerable. So we are optimistic, but very cautious about it. We still have almost 300 active cases. There is, that can very easily turn into a lot more if the public health measures are not taken seriously. And I mean, we are definitely not out of the woods, and it can lead to a third wave if we let our guards down. So we've heard about COVID fatigue, and I do know that many people, because they've expressed it to me personally, we're tired of being locked up, we're tired of staying at home. We want to be given more freedom, we want to be able to go out to work. And so that's a part of human nature, and it's understood, but we really need to take on the responsibility and ensure that we continue as best as possible to practice what has helped us over the last few months.
Dr. Musa, what is working? And I'm saying this because COVID-19, while we've got, or while we had a curfew from 8 p.m. to 5 a.m., COVID-19, day or night, it doesn't matter. And do you think that the public have got a strong hold on, and now starting to understand how severe the situation is, and this is the reason why we're actually holding off from being around each other? What do you think is working?
Well, I think definitely it's multifactorial. The restrictions that have been put in place in December, that had been put in place, definitely worked. A curfew does work because it reduces people from socializing. It ensures that persons are at home in their own, among their own family before a certain time, because if curfew starts at 8, you would have to leave earlier in order to be at home and safe. So a curfew, it's not necessarily that it won't spread during that time, because we do have people who work in essential services after that time. But it definitely reduces socializing and letting our guard down. And other measures as well, the public health measures like proper wearing of your mask over your nose and mouth, social distancing, physical distancing, and in addition to that, the strategies that we have implemented with testing, rolling out mobile testing, testing high-risk groups, detecting the case early, isolating the case very early. All these things have really helped for us to reduce our numbers. But, you know, as things open up a little bit more and as people become more relaxed, numbers can go up. So it's something that we monitor quite strictly.
I'd imagine it's cautious optimism at this point, because you do have to ensure that whatever movement people can now do, that they will still be adhering to all the protocols. Let's zone in for a moment into the testing. There has been an immense amount of testing done in the past 2 months. I understand that was a part of the strategy in being able to mitigate the number of cases we've seen. So Do you have an idea of what coverage we've had so far and how sustainable is it moving forward?
Yes, well, initially at the beginning of the cases in Belize, we were focused a lot on testing close contacts and symptomatic persons. As the numbers started to come down a bit, we expanded this to do going out to different villages, going out to places where people might not have easy access to flu clinics and to hospitals and to polyclinics. So we went out in mobile teams to try to increase the uptake of the test. And this was successful for a few weeks. I know up north on some days they had 100, 125 persons accessing the mobile clinics. And as the days went on and as the weeks went on, we noticed that there was a decline in persons coming to do the test. And there were many reasons for that. Definitely, people were not as ill. People decided there was more than likely a fair element as well that we had to address with health education. And once we've noticed that the mobile clinics weren't as busy as we had wanted them to be, we took another strategy and we actually looked at high-risk groups. So high-risk groups, construction workers, people working in immigration, people working at customs, grocery stores. So any groups that deal with a lot of the public. And we went in, discussed with the employers and with the supervisors, and we've had a good feedback from that. So that's where we are now. We're at an expanded high-risk group testing that has been very successful for us.
And so what I'd imagine the goal is here is to get as many of the asymptomatic cases out of public interaction so they don't continue spreading.
Yes, absolutely. And even persons with mild symptoms who may otherwise think that it could just be allergies or something of that sort, they're encouraged to test as well, so that they can be isolated, and so that we can ensure that they are not spreading to the workplace.
Doc, and we'll be getting Lorena in just a few, but
Lorna.
Doc, in terms, Lorna, yes, I'm so sorry, Lorna, but Doc, in terms of the accumulation of numbers, previously these numbers were coming only from the Ministry of Health. Is that the case right now? Are we getting these numbers from all facilities? We're talking public and private?
Yes, we have been collaborating with private sector from the rapid testing drive started. And many private sector facilities have been testing as well, especially in the Belize district in early December. And throughout. And yes, we do get data from all the private facilities through a different tool that Ms. Lerner could probably expand on. But the data includes private and public testing.
Okay. All right. So let's take a look. I know we have some numbers to look at this morning, and it really helps people to understand how far we've come and where we don't want to go back to. The measure that's often used is what they call the rolling average. So we don't go the day by day and see it up and down. You look at what it is for the week and where we are now. So explain to us what we're looking at here. Is that Ms. Lorna?
Hi, good morning, yes. Yes, Marlene. Actually, to get a better picture, because data changes from day to day.
Yeah.
So looking at rolling averages is the best way you can take a more you get a clearer picture of how the trend is actually going. So in the graph that you had shared, it is showing us that consistent decrease. I think it was from, if you look at, this was from October, it's a 3-month, from October to, this one that you have is from October to, January, 24th of January. If you look at that, you can see that consistent decrease of the rates of infection here. When we're looking at the positive cases, since like about week 50, we call it 50 to 53, you started to see that steady decrease, and up to this moment, that rate has been going down. So it has been consistent then, because at other points, you had some increases, then it decreased, then you see an increase again. But this has been consistently going down.
Yeah. And that is kind of the similar pattern you'd see when you talk about new cases that are detected. But when you look at the transmission rate, that fluctuates differently.
Yeah, the transmission rate, it has a lot to do, it depends a lot on how many people we are testing,
Yeah.
how many people are being reached, how many people are testing positive on any given period of time. So when you look at the R naught that we call it, or the R0, or people refer to it as RO sometimes. Basically, what it is telling us is the rate of transmission. How does one positive case affect how many other people it affects? And for you to say that you're successful, you usually want to be below 1. When your R naught value should be below 1 consistently. At the moment, we are at that point. And I think across the country, most districts are below 1.
Okay.
Of course, you want to go below 5. At some point in time, you want to keep it below 5.
0.5.
If you look at community from community, some of them already have that. The national one here that you're looking at, if you notice, it's I think it's 0.7, if I'm not mistaken. The national reproductive, when you look at the rate of transmission.
Yeah.
So we still need to go.
Just Lorna, if I could, to break this down further, what this means is if we look at the first part of the chart is November 1st. So in November, early November, you were looking at every positive person passing on COVID-19 to 2.5 people. That's what the numbers say, 2 to 3 people.
It was way above 2.
Wow.
So every positive was spreading at that rate. Now where we are is that every positive is spreading to maybe 1.
One person, yeah.
Yes. And you see that gives you that break to catch up, because whilst you are following one person that is infecting 2, 3 or more persons, then by the time you find those 2 and 3 would have already infected other people.
Yeah.
While you have that, you're infecting just one person or less than one person when you look at it from that perspective, then it actually is giving you the opportunity to find those persons and close the gap for transmission. And that's what we want. You want to be able to detect as soon as possible to break that transmission.
Yes.
And that is the reason for that expanded testing. Because right now what you're looking at are what we call the silent spreaders. These are the asymptomatic persons that are out there that do not know they have it, and unknowingly might be transmitting the infection. So that is where we want to go. We want to reach these people, to identify them early, and so that we can break that transmission, that chain of transmission.
Yeah. So beyond looking at how far we've come in Belize with getting the transmission rate down, in looking at new positive cases, I know we must gauge ourselves and the work that we've been doing based on how people around us are responding as well. When you look at the data from CARFA, we know that Belize still stands out with the number of cases that we have, and also a very critical point. You're talking about over 300 families that lost loved ones, which is a very high number for such a small population. Let's talk about how you interpret them as the Ministry of Health.
Okay, so when you look at this graph, if you notice, we are, when you compare ourselves to Guyana, Haiti, and Jamaica, we are up there in detecting cases. So we are finding all these cases, but you also look at how many of the recoveries, which is the little blue dot there. It is telling you how many recoveries we have, and looking at the active cases. So in that area, we have done, again, as I said, we have done well in that the recoveries now are getting smaller. If you look at Jamaica, from the blue dot to the top of the pink line, that is the active cases that are remaining. With us, it is a bit smaller.
Yeah.
Again, the incidence, this is, again, as I said, when you look at the incidence or the new cases that we're detecting on a day-to-day basis, the rates, which is the green line to the back, the green graph to the back, you can see we're a bit lower.
Yeah.
Of course, if we compare ourselves to the rest of the Caribbean, we're doing somewhat well compared to these other bigger islands as such. But locally, I mean, we really have to keep ensuring that our numbers are kept down, because as you rightly said, when you look at the mortality, that is when any life lost is a loss.
That's,
a huge loss for
one life
any
is too
country.
much.
So definitely, whilst we are having a high recovery rate, we also want to decrease our mortality rate. So it's timely identification of the cases so that these cases can be managed and avoid the complications that come with COVID.
Yeah.
Dr. Diaz, maybe you want to shed some light here. So I hear what you're saying, that there are multiple efforts that are ongoing at this time. You're talking about trying to keep your incidence down, less cases being detected, getting asymptomatic people out of public circulation or interaction as quickly as possible. What's the targeted approach for reducing mortality? And if I could just use an example that I know, we've had many COVID patients who've recovered on the show. And one of the things that we've heard very clearly is how quickly one's health can deteriorate without them even knowing. So they end up going directly into a critical situation when they reach the hospital, which increases the chances for death.
Yeah.
So what's the approach from the Ministry of Health in being able to tackle this singular issue?
Yes. Well, like you quite rightly said, initially determining early who is infected and stopping the spread, that definitely is one of the biggest approaches that we can have. If we are not spreading, we will not get severe disease. Secondly, ensuring that persons do come to the flu clinics and do access care if they're symptomatic. Many times the symptomatic relief like Tylenol, ibuprofen, rehydration, all these things help for a person to get back on their feet early. Many of us have had the flu virus, for instance, and we know that you feel weak, you're exhausted, you lie in bed a lot. So all these things can lead to complications like a pneumonia, difficulty breathing, dehydration. So we appeal to the public to access care early, to get medications that can help them to manage some of the symptoms and to try to remain as active as possible. So these things will help initially. So definitely when we started to give out what we call the flu packs at all the clinics for everybody who was swabbed and relatives, that had helped a lot. And in addition to that, persons who were living not in close access to health facilities were very content and happy that they were able to get some of these medications just when they visited the clinics. So that again is another area that has helped us to improve the patient symptoms. But also we have strengthened a lot of the management in hospitals. For instance, in our regional facilities, we have done a lot of training with regards to using the high flow nasal cannula. Equipment has been placed in hospitals. Standardization of care has been implemented, where if a patient shows up to Northern Regional, Southern Regional, the internist, the medical officer, the nurses, everybody have a protocol that is followed. And in that manner, I think that we have been able to at least try to reduce the mortality rate in our country.
I'd like to go back to Ms. Lerner, simply because of the surveillance part of this thing. What are the hot spots right now within our country with an active count of about 286? Where are the hot spots?
Sorry. Yes, actually, these cases are spread across the country, but definitely, if you just look at numbers, The Belize and the Cayo district have the higher numbers or the active cases. We found that when you looking at a particular district, you have communities that might be reporting more cases than others. So you find that the city itself in Belize City has the higher numbers compared to the rural areas. And similarly with Cayo, you find that Belmopan and San Ignacio are the areas where you have most of these cases coming from. So if you look at this current moment, you find that it is within a particular area. If you look down south, for example, in Toledo, they're still having like clusters because of extended families that they have. You find that if somebody is infected, then when you see big numbers being reported out of Toledo, those are just like a family. So these are clusters that once they're identified, it's tried to be cut at that point. So identifying the case and quarantining and isolating positive persons is the approach that we're trying to implement as soon as possible. In the north, it's sporadic cases now, and it is just through, as you said, through active surveillance where our officers are out there looking out for these persons to identify them. So the fact that you have 200 plus active cases that we have detected, you know that there might be some others out there who are asymptomatic and are not aware of it. So these are the target right now is trying to identify these persons through active surveillance, which means we actively are going out there trying to find them. But in regards to hotspots, as I said, it's mostly urban than rural at this point in time.
Let's shift gears for a bit, and we got to get to that vaccine conversation because I know that's what everybody is patiently waiting on. But let's break from what we're talking about with the current situation to talk about what we do when and if the new variants are detected in Belize. Let's start off with what we know about the tests that have done so far, and just frankly, why is it taking so long to get the results?
Yes. Well, in Belize, we can't, and in many countries, the genome sequencing cannot be done.
Yes.
There's a lot of different equipment and specialized equipment to do the genome sequencing. So as I had mentioned before, we had partnered with Baylor College in Houston. So they do have about 300 of our swabs at this point. And CARFA also has 10 of our swabs, and that's the quota that they give different countries different quotas, and Belize has been given 10 swabs a month. So we've kept in constant contact with Baylor, and they are in the process of doing the genome sequencing, but they have asked us to give them another week or so in order for us to get some of the preliminary results from the swabs that they currently have. So it's just waiting to hear, and hopefully, I actually spoke with the doctor in charge yesterday, and she said that definitely it's ongoing, and they will have some preliminary results for us very soon.
So we've not gotten any tests back on strains so far?
No, we have not.
So does that, these samples are taken from what, a week, 2 weeks ago?
Yes, well, we constantly send, every week we package 10% of what has been done, and or less. We only started to send about 2 weeks ago, and the initial samples that were sent were smaller groups, 10 or 15, and recently we sent another 270-something swabs, and they have confirmed that they have received it. And there is a process that has to be done as well. So she was explaining the similar processes with extracting the virus from the swabs and storage and doing other processes in order to check for the strain. So we are keeping in constant contact with them and with CARFA, and we do hope to get some results very soon.
So, I think if and a lot of people follow what's happening in other parts of the world, we know that there is great concern when a variant is detected because of how quickly it can spread. So let me understand this. If we get a positive result for either one of the variants, the UK variant, the South African variant, the Brazilian variant, that would mean that it was from 2 weeks ago. So the potential for that spread to have taken place would be very concerning, I'd imagine.
Yes, well, if we do get, when we get our preliminary results or any results, if we do have a positive case for one of the variants, this would be somebody that has already been detected as positive and is isolating. So hopefully we would have ensured that there is no more transmission at that point for that person or the family members for that person. So it is, we do have a plan of what we will implement if we do have one of the variants, especially the UK variant that is 70 to 80% more infectious than the other strains.
Wow.
So it's basically ensuring that persons who are positive are well isolated. We do follow-up checks on everybody who is positive. We are ensuring that we're doing the health education and reminder to the families, and we're doing our contact tracing as well. So whoever that person is residing with or the workplace, etc., we would have gone in and done very thorough contact tracing as well.
That leads me to ask the question about, before I do that, last year when they announced the reopening of the international airport, there were a lot of naysayers simply because we didn't know what to expect, and we know that especially when it comes to tourism, we've got a lot of American tourists come to Belize to enjoy what we've got here. What are the numbers coming out of the international airport, if you're at liberty to share that with us? Are you?
With regards to the swabs?
With regards to testing, and if there are positive cases when tourists come to Belize, what are the numbers, if there are numbers coming out of that?
Yes. On average, I have it here, but on average, I think we've detected about 30 persons so far from the airport. Ms. Lerna, you could correct me. And we have done almost 7,000 swabs since the airport has opened.
Okay. Well, because some people also come in with a negative test as well.
That's right. So we do accept a negative PCR test that's done within 72 hours or a negative rapid test that's done within 48 hours. And there's also some screening that occurs at the airport. Persons download the health app. We know where the tourists are going, their temperature checks, and a short questionnaire when the persons are passing through the airport. So we do have that data and that information. And they've got to present the test, and they are seen by our doctors and nurses at the airport prior to giving the clearance.
All right. So we've gotten quite a bit of information from you so far. One, that the mass testing is a part of the strategy to reduce the amount of transmission that we're seeing. We are doing much better than we were 2 months ago, but it's not a moment to stop and celebrate. It's just a matter to keep on working. You have a plan already created when there is a detected case, or if there is a detected case of a COVID variant in Belize, that it sounds will go into effect immediately after. So let's talk about the big one, vaccines. When are we going to get them? Where are we going to get them from? And how many are we going to get?
Yes. Well, as was mentioned before, and it's public knowledge, Belize signed on to COVAX facility, and this is a part of WHO, and it was created in order to ensure that there is equitable distribution of vaccines to countries that may not be able to purchase large amounts. Belize signed up to COVAX to get 30% of our population vaccinated. And this equates to approximately 120,000 persons, which is about 240,000 vaccines. So we do know that this is in the pipeline. We've made our down payment, and we're waiting on that. And we have been in constant communication with COVAX, and we do know, well, we have what they term an indicative allocation letter that a lot of the Caribbean and Central American countries have also received over the last week.
Yes.
Saying that the process is now very much near. Within 4 to 6 weeks, we will be hearing more from them with regards to the final allocation amount for the first phase of the vaccines that will be sent to Belize. And we have been given an estimated time of the end of March, early April to receive that first set.
And that first batch, do we know what vaccine it's going to be? And as far as it's been explained to us, it's actually only going to be a percentage of the 30%, something like 3%,
Yes.
we're told?
Yes, that's right. What COVAX has explained to us is that they will send us the vaccines in different phases. They haven't really clearly stated how many weeks in between, but definitely there are 3 phases for the 30%. And they will let us know over this week. We hope to get the final allocation letter before Friday. And in that letter, they will outline exactly how many vaccines will be coming on the first shipment. The vaccine that is stated in the letter is the AstraZeneca vaccine.
Okay.
And do we have the capacity for storage and administration for these vaccines? That's always been a part of the preparation phase that was necessary.
Yeah.
Yes, for AstraZeneca and all the other vaccines, yes, we do. The one that we don't have the storage facility for is the Pfizer vaccine that needs to be stored at -70 degrees.
Wow.
So that's some investment that we have to make, and we have made the decision to go on to make the investment into the freezers, just in case we do get the opportunity to get some of the Pfizer vaccines. We are prepared and ready to accept.
All right.
Is the access to vaccine, are we only looking at the COVAX facility as or sole access to vaccines at this time?
No, not at all. With COVAX, it was 30%. So in order to achieve herd immunity, a country needs to vaccinate 70% of its population, at least 70% of its population. So we still need to look for 40%. And we have been actively working on this. We have discussed bilateral agreements with 2 companies already, and we have also sent out letters and have been in discussion with about 5 other countries in order for us to try to procure vaccines in that manner. So many of them are very hopeful. So I do believe that we would be able to get the other 40%, either with bilateral agreements, which we don't have any bilateral agreements signed as yet, but we're constantly in communication with these companies, or by other countries that we have discussed with recently.
And when you, I mean, I'm sure you're hearing the public clamor for when we'll get these vaccines. We have to be very open about what's going to happen after that first batch. If it's 3%, 5%, which is what, 12, 15,000 vaccines. When that comes in country, what impact is it going to have?
Well, the initial letter that we got has suggested that we'll receive a little over 100,000 doses. And that would be received in 2 different phases. So the first phase, we're looking at about 40,000 doses. And with AstraZeneca, the first dose is given at day 1, and the recommendation for the second dose can be anywhere from 4 weeks to up to 12 weeks. And in fact, more efficacy is achieved if given in the latter time period. So we are looking at the first dose on day 1 and the second dose on week 8 to week 12. So we will ensure that as many persons as possible would be getting that 40,000 of the first dose of 40,000 vaccines.
Oh, okay, that's interesting. I thought it was going to be that you would do 20,000 with 2 doses, but you're looking at hopefully getting a second batch within that 12-week span.
Yes, absolutely. And then the second batch is the bigger amount. So we would then be able to roll out to even more persons.
That is interesting. And, but looking at, I think we feel sometimes that once we get the vaccines that, that gets the ball rolling to get us back to what we knew before 2020, what our life was like. And is that the case?
Well, I do want to stress here that the vaccines doesn't necessarily mean that, well, of course, COVID is not over. And not everybody in the first 2 to 3 months will be vaccinated. It takes time to get the entire 70% of our country vaccinated. So definitely it is not that this is the end to COVID. This is the end to public health measures. the changes that have occurred over the last year will continue and must continue this year in order for us to get over the morbidity and mortality that COVID has caused. And the vaccines will also help to reduce the severity of the disease and help to reduce us infecting other persons as well. So the impact might not be felt immediately, and definitely we at the Ministry of Health and Wellness, we want the general public to know that even when vaccines come to Belize, this is not the end of the measures that we have to take. We've got to continue to be responsible. We've got to continue to protect our vulnerable population, and we've got to ensure that we practice the safest measures as possible with or without the vaccines.
All right. Well, you're breaking it down for us there. And let me quickly get back to Ms. Lorna in terms of surveillance, or as a matter of fact, where in your municipality you're able to get testing in the event you're feeling like you're actually having some symptoms.
Yeah, definitely all districts are providing testing. They usually, again, as I said, within the health facility itself, you can get tested any day, every day. When you see it announced in your community or in your neighborhood, we would encourage you to get tested. The idea is to know your status. I remember when we were campaigning for HIV, Know Your Status campaign. I think we have to go in that direction again with COVID. If we have the opportunity to be screened, then I would encourage anybody that might have been exposed, that they think they have been exposed or that they're having any symptoms to come in and get tested. So it is available at all public health facilities. If you want to go private, there are the private facilities that are also offering rapid testing. But from us at the ministry, all our public health facilities do have access to the screening tools there. So you just have to go to any of our health facilities and seek the services. And I want to encourage everybody, again, as I said, when our testing team goes to your facility or to your community, to take advantage of it. Remember, you might be asymptomatic, but if you think you have been in contact with somebody who is positive, or somebody in your neighborhood has tested, or at the workplace has tested positive, then just take advantage of the services and let us help and keep the numbers down and take it further down.
Yeah. Is it as simple as showing up? Like if I just go to the clinic today and say, I think I've been exposed, or do I have to get, confirmation that I should get tested?
You go through a screening process. Okay. To identify your risk factors. But at the moment, as I said, we are not overwhelmed as we were at some point when we were having hundreds and hundreds of tests being conducted at any point in time. So at this point in time, I don't think there is any reason that we can turn you back if you think you have been exposed.
Okay.
You no longer have to go through the strict screening process where we had to determine whether you warranted a test or not. So at this point in time, we are implementing some level of random testing. The methodology right now, as I said, is looking at the high-risk areas. And if you're within that high-risk area because of the heavy traffic of people that you come in contact with, then we encourage those persons to get tested.
Okay. Wow.
All right. So last chance for a public plea.
Yes.
While we can say that the numbers are looking promising, what do you need from us? What must we continue doing?
Yes, I think that the message has to be that we've got to continue to practice to be responsible, to ensure that we protect the elderly, protect the persons who are diabetic, hypertensive, asthmatics as well, pregnant women as well, because these are our vulnerable population. Yes. We need to not let our guards down. The response against COVID-19 is not just a response from the police or from the Ministry of Health, but each of us as individuals have the responsibility to ensure that we reduce the spread and that we continue in the direction that we're going presently. Even more so, like you said, that if we are not certain what strains are here, but we do know that if we possibly have COVID or symptoms of COVID, we stay isolated, we go and get tested as soon as possible, we get our symptomatic relief from the health facilities, and we ensure that we are strict with our isolation. And in doing these things, it will really help our country to continue in the downward trend. And I just want to appeal to the general public that when we do get our vaccines, that when your turn comes, you do access these vaccines. Yeah. It is one of the best ways that we'll be able to control this pandemic. It's a global response. Every country has to be more or less doing the same thing with regards to the vaccines. And we want to encourage the general population to ensure that they come out when it's their turn and get the vaccine.
Doc, finally, before you go, when it comes to the healthcare workers, we previously heard that there were a lot of them getting infected. At this particular point, where are we with that?
Well, it has been very positive for us. We haven't recently had any clusters or outbreak in our health facilities, and that comes. The reason for that is that we do a lot of health education. We ensure that we do a lot of the infection and prevention and control measures in our health facilities, and as well with the number of cases going down as well. As Ms. Lerner said, we're not as overwhelmed as before with hundreds of persons coming in who are ill. So all these things have also helped us to not have the infection spread in our facilities.
All right, great. And Lorna, last question for you. Is there heightened surveillance in Corozal with the opening of the free zone?
Yeah, definitely that has happened. Actually, over the weekend, they had the screening of the employees just to have that baseline. Where are we with the opening of the free zone? And our team there is at that heightened level indeed. And so the monitoring is ongoing. They have structures in place now and processes in place to ensure that we have early detection, because we know that the potential for infection is high, so we have to step up our surveillance in that aspect and ensure that we detect early and intervene early.
All right. Well, thank you guys so very much for clarity for this morning. Great conversation, and especially spreading that message across the country that everybody should still adhere to all the protocols from the ministry. Thank you guys, and have a lovely and warm day.
And
thank you. Thank you so much for having us on the show.
All right, so we're about to take that break. When we come back, we'll be discussing Scouts. Did you know that February 1st to the 28th is actually being celebrated as Scouts Month? Well, they'll tell us more about it when we come back. Stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Citizens of Belize, Tune into the United Democratic Party's virtual launch of its 2021 municipal elections slates, putting people first. Our teams are capable, qualified, and extremely energized to deliver victory all across the country on March 3rd. Our virtual launch airs on Wednesday, February 3rd at 7:30 p.m. on Channel 7, Channel 5, Love TV, Wave TV, and live on our UDP Belize Facebook page. Your United Democratic Party, renewed and committed, putting people first.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No.
Grandma, we need to go for all of us.
No.
Stop. If you are having flu-like symptoms, please call us immediately for medical guidance. If you have chronic conditions such as diabetes and you are experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
Back to Open Your Eyes. We're moving now into our second segment. February 1st to the 28th is being celebrated as Scouts Month, and this year they're celebrating under the theme The Adventure Continues, celebrating 110 years of scouting in Belize. Now we've got folks to tell us all about it. Connie Castellanos, who is the Venture Scout Commissioner, and Aaron Pook, Director of Communications and Institutional Development for Scouts. Guys, good morning and welcome.
Good morning. Thank you for having us.
Morning. Look, it's a big celebration, guys. We know how important Scout is throughout the world, but exactly where I'd like to start the conversation. Tell us about Scouts and the importance of it. Where did it get started?
Okay, so I guess I will do that part. So good morning, everybody. Scouting in Belize actually started off the record in 1910. And so that means Scouting has been in Belize for, if I'm not mistaken, over 110 years, which this year makes 111 years.
Yeah.
So the entire purpose of Scouting is to contribute to the holistic development of young people from ages 7 to 21 through a system that is based off the Scout Promise and the Scout Law. So we all, and many Belizeans would know that the Scout Promise and the Scout Law is something that we as Scouts take very much value and pride of. We live by it day by day, do a good turn daily. As a Scout is cleaning thought, word, and deed, and other stuff like that. So the entire purpose of Scouting in Belize is to actually help develop the young person who in return will play an active role in society in the future.
Okay. And for you, Aaron, quickly, what made you want to join Scouts?
That is a very interesting question because I've been in Scouting since age 8, if I'm not mistaken. So I joined when I was a cub. I came up in the Scout section and then the Venture section, and now I am given back to the association voluntarily as a leader, or as a director of the association, that is. So for me, what made me join it, first of all, I didn't even ask my mom for permission. I just went to a meeting one day and I signed my name up, and then I brought home the letter to her and told her, "Ma, I done the inner scouts. I take that back." So after all, it grew to be very interesting. It exposed me to a lot of stuff that I personally didn't thought that I could have been exposed to. It helped to develop me mentally, help me to become a very determined person and so forth. So I am very thankful for where I am today in scouting and all the opportunities that it has given to me.
All right, Connie, come in. Tell us about it as well. And is it still attractive for young people, scouts?
Oh, well, in my opinion, it is. I think the aurora of being able to give back to the community while having this close relationship with scouts around the world is a very beautiful thing. I can say that I can call on my friends in Panama or Peru any minute, like when I would want a conversation, and that's not something that I take for granted, and I'm very grateful for that, and the countless opportunities, as Aaron said, to travel before the pandemic, of course, and to create networking opportunities between myself and the association to better further opportunities for the youths of our country.
But that wouldn't be the reason why you joined, right? Why did you join the Scouts?
Well, I joined because, well, growing up, my dad, he's retired from the BDF, so outdoors has been my safe space. And scouting gave me that opportunity to not only be outdoors, to like camping and being out there with my friends, but it gave me the opportunities to learn skills that I won't only use at a camp, but then I would come home and practice that within my community and stuff. So that's the main reason why I joined. Is I enjoy being outdoors, and scouting facilitates that for me.
And how long have you been in the Scouts?
Since I was 10, so going on for 11 years.
Now that's what I find interesting. The people who join it and love it so much that they stick to it all through adulthood. Why is that something? Because you think you're going to do it in primary school, you continue in high school. What has made you stick with the association?
Personally, I have stuck throughout the association because I've noticed how much it has molded me into the person that I am. Like throughout my very impressionable years in high school, there was the likelihood that I could fall into the wrong crowd, the wrong group of kids, and scouting didn't allow me to stray because of the interactive and positive activities that we kept on doing. And I realized if it helped me so much throughout my youth, then the least I can do is continue on as a leader or as a commissioner to continue serving to allow other youths to have that same opportunity as me.
Talk to us about being active or staying active, the Scouts, during this pandemic. What are you guys doing and how are you doing it?
Okay, so our program is designed to whereby all of our members or all our young members from 7 to 21 are outdoors, being very physical, campfires, attending camps, attending training seminars and stuff like that. So when this entire pandemic hit, I understand that it hit everyone at the same capacity, but for scouting and scouting in Belize, it was something that we completely did not expect, something that our association was not prepared for. So when the entire pandemic happened, we had to take a step back as an association, and we had to look, assess, and plan as to what we will be doing moving forward. So that is whereby we took all of our year's program and we carried it online. So now, as I said, I think I said this yesterday while I was on Love also, we are used to seeing scouts outside in uniform and everything like that. And now we see scouts in a screen in uniform. And it's kind of a weird feeling for many of us who are used to being in the uniform. But at the same time, we want to ensure that we keep our members safe and everything of that sort. But at the end of the day, we still ensure that we delivered the program to the young people, because at the end, because we do have an obligation to do so as voluntary members of the association.
To date, how many members are a part of Scouts in Belize?
Okay, so we actually just gave our 2019 report 2 weeks ago in terms of the census membership, and we have a total of, including the managing board of the association, we had around 200 and plus members countrywide. And one of the biggest reasons for that is that it's very hard to find the adult to volunteer to be a leader. That is one of the biggest things that our association faces right now as a challenge.
And how do you recruit, though?
Especially right now.
It's so important that you have new, and you have from the Cub Scouts right up to your ventures, and you have your, what are they called again? The adults that help to lead the pack?
The leaders?
The leaders, thank you.
Yeah.
Yeah, so you're constantly recruiting for all these different groups. How do you do recruitment since 2020?
So it's been, I'll be honest, it's been very tough, and it's been a struggle for our association because of the entire outdoor aspect of the movement. So one of the biggest things that we found that really works is that whenever we maintain this social media activity and posting what all we've been doing online, it generates a site whereby outside viewers of the association get to see the activities that we're doing, and it makes them get interested in the movement. They send in message to the Facebook page, the Instagram page, via email, and they start to call, and they want to know, regardless if it's online, how could their child be a part of that still?
Yeah.
So that is one of the good thing about it. Even though it's a challenge, we're still getting few members here and there every now and again.
What is that dance that's going on the screen? If you guys could see it.
Oh, I have it on the tip of my tongue.
It's been too long since you've been at camp.
It's been too long.
What's the game you guys play in the water? There's another game that you play in the water.
Connie, you remember that one? We remember water polo.
There's water polo. Okay. Yeah.
And then there's the one that we play in the mud. It's called Argoya India. That's a very hands-on game.
Yeah. So I've been to Camp Oakley a few times, and I know a couple scouts. But this is what fascinates me. I think it's great to see young people who still want to get engaged on a completely different level, from learning to cook, building your fire, doing your knots, survival training, living in tents, setting up your tent. It's skill sets that we never know we need until we need them. So how do you get how important is it that you also have parents buy-in to want to get their children involved?
Oh, the parent support is one of the biggest aspects of the movement also. Like what our program executive would say, Mr. Palmer, he would say that without the parents, we wouldn't have any scouting, because it is the drive and the interest of the parents to put their children into the movement, because they can foresee that the movement will assist them to become that better person in society. And I am not the type of person that like to talk about the negativity that our country faces in terms of violence and stuff like that. But at the end of the day, it's good that they know as parents that there is a movement that will provide for their children to, go down that right road, become a positive person in society. So the parents are a very important aspect of the movement.
Yeah.
Connie, I saw a picture, I think it was you, embracing a younger scout, a female. What is that like, being a female, having to go on out there and dealing with all these nature stuff that folks would say, man, I'm not going to be a part of it. How is that like for you, and why would you tell your peers, females, to be a part of the Scouts?
It's not much of a difference for me, because within scouting, there's not a difference between what a male can do and a female can do.
That's lovely.
We embrace whatever abilities you have. We will find a way to enhance them. And what I would say to my female peers wanting to join the movement is that there is no limitation to what you can do, and there is no reason to have that mentality and go into a movement such as Scouting thinking that there will be a time where someone will tell you, no, you can't do that. Please calm down, relax. No, they give you that platform to express yourself, and they facilitate that growth that us females, like for example, for me, one of my things was when I started Scouting, I was so shy. I didn't want to speak in front of crowds. I didn't want to take up a position where I would be the leader of something.
Yeah.
And what Scouting did for me was tell me, you have all rights to be a leader, and no one can tell you that you cannot be a leader. So that's one thing I would highlight when talking to females about joining the movement, is there's no limitations within this movement for you.
Wow, Connie, well said. So February 1st to the 28th,
How you
celebrating as Scouts. How do we celebrate?
Yeah, so Scout Month, just a slight correction, our theme for this year is growing stronger together.
Yeah.
The reason for this theme is that now we have a newly elected administration, and we want to move forward throughout this term by showing that with our unity, we have strength. And that's what we want to highlight throughout this entire month. So starting off the month, we started on February 1st, of course, and on the 5th, we have a red flower event for the cubs. Now what that is a campfire for the little cubbies. So that's the kids ages 7 to 10. Am I right in that, Aaron? Just to clarify. Okay, good. So for that's where they'll have their game nights and they'll have their social interactions with the little cubs. And on the 7th, we have a leader appreciation / recognition day. And that's because we want our leaders to know that their work as volunteers is seen and it's appreciated, and we respect and want them to continue with the work that they have been doing, because as challenging as it is, our movement wouldn't be possible without their support and the support of the parents. And on the 11th, we have a Throwback Thursday, which is a social media campaign where we're asking our members to post a throwback picture of their favorite Scouting moment.
That's so cool.
That'll be something exciting. I'm looking forward to that one. And on the 12th, we have a Venture Campfire, and that's an event that I will be hosting for the Ventures of the Association. And it's another social event. It'll be filled with like a lot of interactive activities, and we're pushing to get as much ventures to sign up. So I want to encourage them to come out because we have a lot of surprises planned for them. And on the 14th, we have a event called the Table for Two. Aaron, would you want to elaborate more on that one for us?
Sure. So the Table for Two, obviously it falls on Valentine's Day weekend. And we wanted, along with our Director of Education, Ms. Marlin, she came up with the idea to whereby we want to have fun as leaders, but without the kids present, meaning that we will not be doing, how to put it in the proper words? Leaders just want to have fun together.
Yeah.
But we can only do that in the virtual space at this moment. So what she came up with is that leaders, you don't have to be single you don't have to be in a relationship. You can be single. We just call it Table for Two because it falls on Valentine's Day weekend.
Yeah.
But she came up with the idea to whereby leaders can sign up and attend this virtual space, and they're in a restaurant. And they get to choose any restaurant in the world where they wish to be. So they can be a restaurant in Paris, a restaurant in Dubai, a restaurant in Egypt. And that is one of the main advantages of this entire virtual domain, is that we can place our leaders or scouts anywhere in the world where they want with their virtual backgrounds. So with that comes the agenda to whereby they will have entertainment, DJs, and even a raffle for the leaders at the end of the night. So that is just another part of giving back to our volunteer leaders as coming from the association itself. So that is basically Table for Two.
Cool.
Okay.
Yeah, and our events continue on. So after the Table for Two event, we have on the 17th a good turn day. With scouting, we are very big on service and giving back to the community, and do a good deed daily is a slogan that we use. It is our scouting slogan. So it's a day where we highlight being kind to one another, which is especially important during these times. And on the 19th, we have another campfire, but this time for the scouts. Those are the youths ages 11 to 15. And it's another social event for them to, get in contact with one another again, because they haven't seen each other in so long in person. And on the 22nd, it is our Founders Day and Uniform Awareness Day. That's when we're asking our members to put on their uniforms, even if they're at home, to just, when they walk outside, to show their neighbors that the scouting movement is very much still alive, And it'll be a nice way to just show the community that we're here and we like that visibility. So that's an opportunity we're taking there. And on the 23rd, we have another entertainment night for the scouts. It is a talent show. So looking forward to see all the amazing talents that our scouts have to present for us that night. And on the 26th, we have a Flash Forward Friday. That's another social media campaign where we'll be asking our members to be posting a picture of how they're experiencing scouting now in 2021. And to wrap up, on the 27th and the 28th, we have a unit council training, the part 1. This is a training for scouts where they learn the basic skills of scouting and they understand their promise and their law to the organization. And it's a good way to end the month because it gives us the opportunity to remind the youths, especially the ones between that age range of 11 to 15, that the movement is here and we are in full force. And with all the limitations that we're experiencing, we can still overcome them. So it's a full calendar for us this year.
It is a very full calendar, and it sounds like you guys are definitely going to make sure that you keep the association visible and that you get to enjoy reflecting on some of the memories that you've had and building new ones as well. Aaron and Connie, thank you so much for joining us.
Thank you.
Thank you too.
And happy Scouts Month.
Thank you.
All right.
All right, so we're about to take a commercial break, and when we come back, Obia sauce. But it's delicious. Timagus is the man who is doing it, and he'll be in to talk to us about Obia sauce when we come back. Stay with us.
Money. What is it? It's a tool, traditionally made from a small piece of paper or metal and handed from person to person, traded for food, clothes, or anything else you desire. These days, we don't rely on physical money much. Money has become a stream of ones and zeros, endlessly cycling around the globe on a superhighway called the internet. But where did money come from? And where will it go next? Sometimes the best way to see what comes next is to look at the past, and the idea of money was invented way before the beginning of written history. It all started with the barter system. If you were a farmer in these days, leftover crops would be traded for bread from the baker. In ancient China, instead of carrying around hundreds of items around with them, people began to carry small tokens that represented the items that they wanted to trade. Ultimately, these tokens were replaced with abstract circles that could represent any item. According to early writings, Roman soldiers were paid in salt. It is believed that this is where the word salary comes from. The first coin we recognize today were issued in Turkey, and they were made of electrum, a naturally occurring alloy of gold and silver. Moving from coins, paper money was introduced around 700 AD and was developed by the Chinese shortly after they invented woodblock printing. They called it flying cash, as it had a tendency to be carried away by the wind. When Marco Polo visited China in the 1200s, he brought the idea of paper money back to Europe with him. paper money wouldn't see widespread adoption in the West until mid-1600s, when banks started issuing notes that promised to pay bearers on demand a sum of gold. Merchants found it much simpler just to trade the notes with each other, rather than lugging around large amounts of unwieldy metals. During the American Civil War, both sides issued huge amounts of government-backed paper currency to fund the war as they weren't enough gold. Union currency became known as greenbacks. The green ink on the reverse side is a color we still associate with money. Fast forward to 1946, the world's first charge card, named simply Charge It, was introduced. It was limited compared to modern credit cards, but proved such a useful concept that it led to the creation of Bank AmeriCard, now known as Visa, and MasterCard. With the introduction of ATM and cash machines in the 1980s, money had finally entered the digital age, and now everyone need to carry around a debit card along with their PIN number, and they could access their money anywhere that had one of these machines. Then came the rapid growth of adoption of the World Wide Web. Electronic money services had emerged, giving customers an alternative to traditional cash. Coupled with innovative technologies such as chips and pins, people around the world now enjoy making contactless payment at their favorite stores. It's now more clear than ever that our reliance on physical cash is on a steep decline. Convenience and security is what will pave the way forward for how business and customers transact in years to come. The phenomenon is coming to the Belize market. Digital wallet, a powerful option to physical wallets. Digital wallet can be very handy as they can get rid of carrying cash everywhere. Digital wallet proves to be safe, easy, and immediate way for customers to pay online and further minimize the hassle related to cash transaction or waiting in line for long periods of time. The digital wallet is developed to increase customer safety and convenience significantly. So what does the future hold? The future is now, and it's powered by eCash.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
Are you traveling? Effective January 26, all passengers traveling internationally will need to get tested no more than 3 days before you travel to the United States, and show your negative result to the airline before you board your flight. Here at Caring Hands Clinic in San Pedro, we administer the antigen test, frequently referred to as a rapid test. Our products are CDC compliant and FDA approved. Testing has never been this easy. With our highly certified and licensed medical staff, we provide you with an accurate test result in minutes, making your experience fast, safe, and easy. To book your appointments today, contact us on any of our hotlines at 671-TEST or 672-TEST. 226-FAST or our Vonage line at 305-420-6203. Book your appointments online at www.belizecovidtest.com. Caring Hands Clinic Antigen Test Center. We're pleased to serve you.
Citizens of Belize, tune into the United Democratic Party's virtual launch of its 2021 municipal elections slates, putting people first. Our teams are capable, qualified, and extremely energized to deliver victory all across the country on March 3rd. Our virtual launch airs on Wednesday, February 3rd at 7:30 p.m. on Channel 7, Channel 5, Love TV, Wave TV, and live on our UDP Belize Facebook page. Your United Democratic Party, renewed and committed, putting people first.
Why, Tony?
Boy, kid, what you going on, man?
We actually come see you because I need to buy a stack of them plastic plates and cups for my grocery shop because I run low.
Boy, I stopped importing that thing since April 15th, you know. And I just routed the last batch, must be about like 3 weeks back, you know.
Man, do I usually have anything? What is going on?
Check this, right? Under the new law, we ban all single-use plastics, so that the cups, plates, forks, spoons, and knives, all of that. Since April 15th, can't import none of them. Starting January 15, 2021, you can't manufacture them. April 15, 2021, you can't sell them. And after July 14, 2021, if you get catch with any other thing, you will get fined.
Me never know this. I guess I have to make some changes then. I have to make the customers know that anything not available. Anyways, bro. Thanks, man.
No problem, man. Take care.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No, 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 no.
Grandma, we need to go for all of us.
No, no, no.
Stop. If you are having flu-like symptoms, please call us immediately for medical guidance. If you have chronic conditions such as diabetes, and you're experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
Keeping safe from COVID-19 at your workplace requires 100% teamwork. You can keep earning while keeping yourself and others safe by doing some basic things. Wear a face mask at all times in the workplace unless you are alone in your own private space or office. Wash your hands frequently or utilize alcohol-based hand sanitizers and avoid touching your face. Disinfect surfaces like doorknobs, tables, desks, and handrails regularly. Increase ventilation by opening windows or adjusting air conditioning. Limit visitors and deliveries to the workplace and use appointments where possible. Attend meetings virtually as much as possible, and when not possible, hold meetings in open, well-ventilated spaces or rooms that allow for everyone to be 6 feet apart. Stay at home if you or a family member at home are feeling sick, or if you have been in contact with someone who tested positive for COVID-19. Keeping the workplace safe also requires that employees act responsibly when away from work. Practice social distancing and good hand-washing hygiene. Avoid large gatherings and avoid unnecessary exposure to others. Protecting others means protecting yourself. Together, we can defeat COVID.
In partnership with the British High Commission.
And we're back!
Welcome back to Open Your Eyes, and we are moving into our third and final segment. Now, we're here with the man himself, my brother, Tim August, and to tell us all about this nice sauce that he'll be doing, and you always have this place rocking. My buddy, good morning and welcome.
Good morning, Marlene. And, yes, thanks for having me. I missed the place. I mean, COVID got with my put up. So
yeah. Well, you know, we did the virtual, and that was very hard for us to watch.
Yes, so I know. So I can make it up to owner as promised, no?
All right.
So, like I said, I always feel appreciated. Channel 5 always got me and, you know, helped me with the exposure and everything. And right now, with COVID especially, you know, I feel a lot more grateful because we get the opportunity to showcase what we've been doing, how we survive COVID as a small businessman, as a small entrepreneur. I know a lot of entrepreneurs are struggling in Belize right now, but we had to come out and think outside the box, look at the bigger picture. And so what I did, I said, if people can't come to Stone Crab, then I would have to send stone crab to them or figure out how to get stone crab to them. So what we started doing, we've been making our sauces for the last 8 years, but it was always an in-house thing. So if you want it, you have to come for it. But COVID we made some drastic decisions, and we brought the sauce out, and so we started battling our sauce, right? Like what I told you earlier. John wanted to know why I chose a light bulb. And I told him, I said, it's because it was a bright idea.
Good one.
Yeah. So marketing, you know, a little marketing strategy.
Yeah.
And this is our base sauce. This is a sweet and spicy. We nicknamed the Obia sauce, so be careful.
Obia sauce.
Well, actually, it's a young lady in Dangriga. She bought food and she posted on Facebook. She said, I don't know what Tim do with this sauce, like Obia with this sauce.
And the name was created.
Being the marketing guru that I am, I just grab that and carry it. So we've been doing very well with this. We have it in stores now. We have it in Family City Imports in Dangriga. They have been very good to me, launching the sauce there. I have it in Family City Shopping, and then I have it in Quality Poultry in Dangriga, and then in Belmopan we have it in Caribbean Chicken at Brody's and at C&J Enterprise.
Excellent.
So what happened is last year we were just at home, just doing nothing, and the government, that little NSME came out, and I said, they gave us a $2,500 grant, and I said, what am I going to do with this? I need to think and put this money to good use. I don't know who will take my 25 and put it to good use. But
you did.
So you applied for the grant for small businesses.
Correct. And I could say, I don't know who else will give the government credit or whoever credit for that program, but this sauce bottling also start from that.
Okay.
So I got the 2,500 and I did the branding with the money. I did the branding, the labeling, you know, Wanderlust Studios. They gave me a very good rate. And they did the branding, mask, shirts, tags, everything for a very reasonable price, knowing the time. And then I went into the banks. I didn't have a bank account. I didn't have anything. So I spoke to the managers. I have to big up Ms. Troy Lane of Belize Bank. She gave me I never have a bank account since 2018. She gave me an opportunity to reopen a bank account. So I started showing the figures. Then I went into National Bank and I spoke to Mr. Castillo. Very, very great man. You know, not lie to you. He tell you it like it is. He said, Tim, if you could prove to me in 3 months what you could do with this sauce, I want to help you.
Wow.
So I started out in October and I push. I got out there and I pushed this sauce, you know, and I started showing him the numbers. Now yesterday I went in and he said, you have an approved loan.
Nice.
To forward with the sauce.
Expansion of the business.
Definitely. So big up.
Which means you're ready to come and open your eyes and now you could keep up with the others.
Correct. So just yesterday I trimbled and all of the sign. And the man said, just push it. I know you reach far. He said, this thing have the potential of reaching Walmart. And that make I give it even more momentum. So big up National Bank, Mr. Cass, all entrepreneurs. If you have something solid, well, on a one challenge on yourself, go in, talk to the man, and he can put on to the test. If you pass the test, you're good to go.
So when you put the sauces in, when you created the sauces, everybody who has had your food, your wings and several other dishes, you use this sauce. And so we joked about the Obia sauce before. But you put it out into the market because you couldn't open your restaurant. I mean, what was the level of support you were getting? Is it like off the shelves immediately?
Oh yes. I couldn't keep up. I still can't keep up. I mean, you know, because it's just small scale, and I'm trying to do it like a boutique style, but people, it's so heavily demanded. And then what I do sometimes to promote it, I go in front of the store and I sell dollar wings. And then so people walking in, they get to taste it right away. They want to know, how can I get a bottle? go in the shop. So by the time I leave the store shelves are filled. Then I just restock them, and then you know. So I'm doing my little marketing, and I use a different strategy.
Yeah.
And what happened to the breadfruit?
Well,
the breadfruit man.
Breadfruit is still my thing. I mean, I've been monetizing breadfruit. You know, you can see on the screen how many things I've been doing with breadfruit. People call me the breadfruit king. You have dubbed me the breadfruit general. So what I'm doing now is we're taking breadfruit to another level.
Okay.
Right?
Let's start.
So breadfruit.
Yeah, we gotta get into some cooking now.
I stopped calling breadfruit just breadfruit. I call it the golden fruit.
The golden
because
fruit.
I'm sure that breadfruit can solve a lot of problems with hunger, food security, and different things. And it has so many potential. Like right now we're studying, we're doing our research on doing flour to breadfruit, different other products, get it frozen and put in stores, and you know, making different things. So hopefully, well, I don't say hopefully, the next time you invite me to the show, or I'm invited
we'll
to
see what new you're doing with breadfruit.
It won't be this, it will be breadfruit products.
Well, listen, after we done see the breadfruit burger and the breadfruit tacos, I'm excited to see what will happen
I
next.
have been doing a lot of things. So one of the problems with people why they don't like breadfruit, mess with breadfruit, is because they don't really know how to handle breadfruit. Oh, it's sticky.
Yeah.
Oh, you know, nice.
It browns it oxidizes very fast.
Correct.
Yeah.
So today I'm going to be unveiling a lot of little secrets.
Okay, let's see.
The first thing about breadfruit, when to pick it.
Okay.
Right? Breadfruit, you know when to pick it when you see it start releasing. It has some, like you see, like little gum or latex.
Okay.
That will start to excrete. Once you see that, it's a sign that the breadfruit is starting to mature.
Okay.
So the longer when you see that, you can pick it right away, or you can just pick it by process, maybe based on size. You have different size breadfruit, different, you know, in different species. There's actually 18 species of breadfruit.
Wow.
So there's a lot. And
are these the same? Are these the same species?
These are the same.
Okay.
But these are from the same tree, but there's so many of them.
Okay.
Some will have more gum, some will be different shape, different size, different texture, everything. So what we're going to do today is show people how to dissect a breadfruit so that they know exactly. The first thing you'll need to have is maybe, let me get
water.
I have a basin of water here.
All right.
And this is vinegar. Right?
Okay.
So you pour vinegar in the water.
Put vinegar in the water.
All right.
That right away will keep the breadfruit nice and white.
That's right.
It will, you know, take up the acidity and everything.
All right, so let's put it here so that we could actually, you're finished with that? Cool.
All right, so the next thing is staging your breadfruit to cut. Right, you want to have a firm thing, so first you take off the head, right? Okay. That's the head, and then if this starts to bleed, you dip it in the water for maybe a minute or so.
Because sometimes like the gumminess starts to come out.
But this one is really mature and ready, almost ripe, so you don't need to do that, right? If it starts to bleed, you take it.
Okay.
You take off the bottom, so you have it on a.
Oh, so you could sit down
like a pineapple.
All right, and then from there you just, you know, edge with your knife. You use this little edge as a guide, and you go down.
Well, it always helps to have a chef knife like you do, right? Because you just glide right through.
Oh yes, this you have to know to choose your knife, because this is a 14-inch blade, and I don't recommend anybody try.
No. I was just saying sharp. I'm not even talking about the
length of it.
So we'll clear this.
Okay. So why did you put it in the water though?
Well, this is
that's just because he doesn't want to put it. But what you would do is, as soon as you're done cutting that up, you put it in the water.
Yeah, if it starts bleeding, like right now, you see my hands are clean, so I don't really. But after that, you want to get it in 4.
Okay.
So that's there. You always want to keep it on the flat side.
Okay.
So.
Bam,
all right.
Bam.
So here we have 2, and then here we have 4. Now we can start making products. Now, these you can leave on the skin, or you can take off the skin and steam it, and then you can freeze it. Then when you're ready to use it, you take off the skin and you do what you want with it.
Cool.
Right? So that's one way of preserving it. Now, to make the fries, right? We go down I know Marlene excited about
Yes,
fries.
you just said if I rush it to the fryer.
Yeah. So this is alright, and then from here you just go, and then I'll start throwing
Fry size, yeah.
Okay.
Because I know how it is.
How time goes quickly, right?
TV kitchen, a quick thing, bro.
Yeah. That's why I said. So just put that in.
Okay. Excellent.
Right. And here we see we're making. If you have a little bad piece, that's the beauty about it. You can always
Just take it
eliminate
off.
it.
Yeah.
Right.
So the core, you can still keep the
You
core.
can still do this like if you're doing steam, like if you're boiling it or steaming or so, then this becomes edible. But the frying time for this will not recommended to have this.
Okay.
Now what you can do is like pieces like this, you can still take them and steam them or fry them and use them as a base. So if I do a fish, I'll use this to
put it on top. Yeah.
Okay. Then I'll decorate that fish.
You
or
are
so
so right. I am amazed that these aren't completely brown. If I
Yeah.
cut a breadfruit, I feel like by the time I
know
make
when
the
to
first
pick them.
batch,
All right.
yeah.
So that's another way.
Okay.
So the other way is to eliminate the heart.
Okay.
That
take
way.
that out.
And then you can do two things.
Okay.
You can start making chips this way. Right? You can start making chips that way.
Okay.
Right? Or you can
take out the heart again.
And then you can. Some people love it this way. This is how some people love thin breadfruit.
That's it, traditional.
Yeah, that's the way I know it too.
So everybody cut breadfruit like this.
Yeah.
You cut it on the reverse.
Okay.
So then you got that base, and then you can guide. So you decide the thickness here.
Yeah.
So if I want it very very thin, then you guide it to what you want. So, so you have a thin.
That's thin. Yes.
Yeah.
Yeah, you can throw those right in there. You know?
That's
oh,
it.
No.
That done already?
We did that.
Okay. Oh, we got this.
Yeah.
All right. TV.
So we have several
All right. So these
ways of cutting them.
Chips or fried style.
Yeah,
So where are we gonna?
Yeah, so these can come out. We'll just put these here.
Oh, wow, we even utilize the leaf.
Yeah, well that's our plate for today.
Okay.
All right, then. So you have that way. All right, so let me just put that this. So that's I'm just gonna leave those out here so people can see the different ways.
Okay.
Yeah.
Right. Like I said too, some people like to do in the morning. They like to have hash browns. So instead of potato, you can do breadfruit hash brown.
Well,
right. So you just cut them up a little smaller.
Yeah, and those are hash browns.
And these are your hash. These are good for hash browns. You know. And then what I do sometime too. Let's go here. This here. All right. So this is the one everybody wants to know.
Okay.
This is the one everybody wants to know, right? The breadfruit burger. I say, how you do a bread?
Yes, we
that
want to know
is
that.
true. How you even get to that shape?
Breadfruit burger. So this is the trick with the breadfruit burger. The bun will be the base of the breadfruit.
Okay.
Right. So this becomes the top of your bun.
Okay.
So you can eat breadfruit skin, but you know if fried it's crispy.
Yeah. Okay.
So this is right. So this becomes
that's your base.
This becomes the top, and then you just take off another piece. Right. And then you skin this.
Yeah.
Okay.
And then you can put this together to get it equal, one equal shape. Right. And there you have it. Now what you can do is for it to fry good, then you just give it an amount of poke so that the fat can penetrate. Or you can bake this or you can steam this.
Okay.
Right? Then this goes in the fryer. Right?
That's it.
So this will be So
okay.
Yeah, so let's put these in so we can show people.
Because we eat that top.
Right.
And then because it seems you've got a million ways with the breadfruit.
Yeah. All right. So what we do also now is we can take this now and make tortillas. So we measure and we just go across.
Yeah.
Miss that one. So here now we have things. So from here now we can.
Oh, that's how you do the top. Okay.
And you use.
So this I can either clip it with my hair or I could just utilize some pins. Alright, I could utilize some pins.
And then you're gonna fry it
and
that
then
way.
you just fry it, right? This one now, I can go again and I can get another slice, and I can make a quesadilla from here. So when you say you fry them, and then you put all the stuff you put for quesadilla, and then you simply same thing. You just go and slice up your quesadilla.
Slice it up, yes.
Yeah, and then you have your quesadilla.
Which I am good with that, yeah.
Yeah.
So basically what you have done is just take every way that you can use tortilla or bread and replace it with breadfruit.
Definitely. Breadfruit is a more healthier choice. I have no problem with corn. I have no problem with flour. But what I'm saying, we have breadfruit growing in abundance in Belize.
Yeah.
We need to start utilizing breadfruit more.
Yeah.
So this is, see?
That's how you just flip that over.
And then this what you can do after a while, you can just pull the pins.
Because it already has the shape. Oh.
So see
Look at your burger.
Yeah, so we have our burger here.
Yeah, you can put it in the plate, yeah. Alright there.
Alright, and then if I put this here now, we can quickly dress up a burger.
All right.
Open this one.
Yes, sir.
And when you look at
so we put our same way like you're making a burger. Put in your mayo. I mean, we don't have any meat here today, but
that's
we're doing veggie.
Yeah, we're doing veggie. So you put that. You got your cheese. You got your cheese. You put your tomato.
Well.
Yeah. You get a piece of onion.
Yeah.
So say we just put this whole piece of onion today.
Okay.
Onion. Alright. And then, like I said, you put the next piece of lettuce.
Lettuce plain meat.
Yeah, lettuce plain meat. And then, like I said, whatever else you want to put. Whatever else you want to put. You want to put some jalapenos.
Yeah.
And
what about that sauce? You can't put that sauce in there?
Of course.
Give me the Gomez sauce.
If you put this, you can put a little bit of your sauce, especially if you have a burger patty.
Yeah.
You can put a little bit of that.
So let's be clear, it's a burger, so you would actually put meat or some kind of protein in there. We're just skipping that part
today. Put it right here on the side, yes.
And then, like I said, with the tacos, almost the same thing. We have our taco shell.
Yeah.
You can leave on the skin or you can take off the skin.
Okay.
Right? This is how I do it. So what I do, same thing. Since we have the little ingredients here.
Yep.
I would just pack this good with
some veggies.
Some veggies. Right. Here would be the piece where the meat would go. But we don't have meat today, so we're just gonna do veggies. So gonna pack that.
Some salsa.
Look man.
Pica de gallo, and then
we put in some
pickled cabbage.
Right. And then we could put some cheese.
Oh.
Give me a happy call.
Yeah.
Yeah, this could be shredded, this could be blended. So there we have
There you go. We can put the fries on the side one time. So
yes.
So let's put the fries on the side there.
Yeah.
All right.
And like I said, you could put a little magic and put a little salt.
So people eat the fries with the sauce too?
Yes.
Yeah. So you put it on wings, you do...
People tell me they put the sauce on popcorn. Right? I got people that order nachos and they want the order of sauce too. So
you know what?
All right, so there you have it.
There you have it, yeah. There you
That's the many different ways that you can prepare breadfruit. Now let's talk about where people can get these sauces.
Well, yes, right now we're launching, so I want to tell you today that my official launching then.
Yeah.
Official launching.
Yes.
So I already have it in Brody's Bamapan and Caribbean Chicken in Bamapan and at C&J Enterprise.
Okay.
C&J Enterprise is a small business also, a young entrepreneur. He does the printing of my label, so we don't exchange money. I give him sauce to sell and he prints my label. If at the end of 2021 I owe him or he owe me, then we are pay up. So that's how we're trying to work. And then in Dangriga, It's at Family City Imports. They're my biggest supporters. You know, they treat me like real family. The name says it all. They treat me like real family. They gave me permission to go in front of the business, you know, sell my sauce, promote my sauce, and I'm restocking them weekly now.
Okay.
So I know that something good is happening there. I have other young entrepreneurs that are selling wings that want to also use the sauce, and I have no problem with that. So if they want to buy the sauce, I will give them at a very good rate by gallon, so that they in turn can start, so that I don't need to go to them.
So other than the fact that I get my sauce personally delivered,
so this
when I run out, where will I go to get it if I'm in the city or in some place where it's not on the in the store?
I am hoping that since I have it in Brody's already, that they will definitely accept it. I know they have told me bring it in, so the one on the northern, but at the time I didn't have a proper label. They didn't have a barcode and a nutrition fact.
Okay.
And by the way, what I use to preserve it is all the ingredients are there. The nutrition fact. I use dry moringa. I don't know if you guys know about moringa.
Yeah, we know.
But that's another powerful thing. So I use that as my natural preservative. So these don't need to stay in the fridge. These can be out because any bacteria or anything that gets in there, moringa will eliminate that. That's what moringa do. Moringa can actually purify water. So hopefully I get it into Brody's today in the city.
But people can order it online from you?
Yes.
Like from Facebook?
Correct. They can go to my page, Stone Crab Bar and Grill or Tim August, and I ship the fries, the breadfruit fries and the sauce. I do it on Tropic, BPMS. The fries can only come on airplane because then it needs to.
Yeah.
And breadfruit is compared to a banana, right? It has the same shelf life.
Okay.
So if you have bananas and you have breadfruit, that's basically the same shelf life.
Okay.
It's ripe at the same speed. If you pick the breadfruit today, it's best to cool it down because any way it stays warm and dark, it will start to ripe.
Okay.
Yeah. So that's another thing. People usually have their breadfruit and it ripe. If it get ripe on you, then
you can make porridge.
You can make porridge or you can roast it. You know. When I won a cooking competition one time, I used the pineapple core, took off the head like this, took out all the inside, stuffed it with all the good stuff, cheese, meat, everything, and put on back the head with pins, and I roasted it. Everybody think it was just a regular breadfruit until I
slice it
in half and everything. So it's just being creative with it, and you will.
Well, that sounds
it'll make
delicious.
magic. So consider breadfruit like potatoes on a tree.
Yeah.
The price is, 1/3 the cost.
Yeah.
So if people would start using breadfruit more, and we're definitely going to get into the farming aspect of it and making other products, like flour and that type of thing. So
all right.
The next trip I'm here,
it's going to be with the flour.
Today it's all about the Obia sauce, your special sauce.
Yes.
And we do want people to know that they are available in some stores. If you don't have it in your area, you can reach out to Tim online and make that order as well. And as you said, you also offer to send out on plane, Tropic Air Maya, the Tropic Air Maya, the breadfruit fries as well.
Okay.
Tim, it's great having you here.
Always nice.
Always.
I'm ready to do some breadfruit sampling, so we got to take a break. We'll be back.
I hope no memes this time.
We'll take the break. We'll be right back to wrap things up. Stay with us.
Thank you.
Oh, man, that was good.
Cool kid, I do the dance. Captain, I do the dance. Energy, I do the dance. Shakespeare, I do the dance. Loco, do the dance. Which dance? Breadfruit. You want breadfruit? Just tell me if you want breadfruit. Breadfruit. You want breadfruit?
Are you traveling? Effective January 26, all passengers traveling internationally will need to get tested no more than 3 days before you travel to the United States, and show your negative result to the airline before you board your flight. Here at Caring Hands Clinic in San Pedro, we administer the antigen test, frequently referred to as a rapid test. Our products are CDC compliant and FDA approved. Testing has never been this easy. With our highly certified and licensed medical staff, we provide you with an accurate test result in minutes, making your experience fast, safe, and easy. To book your appointments today, contact us on any of our hotlines at 671-TEST or 672-TEST, 226-FAST, or our Vonage line at 305-420-6203. Book your appointments online at www.belizecovidtest.com. Caring Hands Clinic Antigen Test Center. We're pleased to serve you.
Citizens of Belize, tune into the United Democratic Party's virtual launch of its 2021 municipal elections slates, putting people first. Our teams are capable, qualified, and extremely energized to deliver victory all across the country on March 3rd. Our virtual launch airs on Wednesday, February 3rd at 7:30 p.m. on Channel 7, Channel 5, Love TV, Wave TV, and live on our UDP Belize Facebook page. Your United Democratic Party, renewed and committed, putting people first.
Henry, oh. And we're back, just like that. We are back, but we were tasting. That was what we were doing.
Pretty much the fries disappeared, right?
Yeah. So
and we still have Tim here working.
Yeah, we've got Tim because he is jamming. But we've got to go. We want to say a big thank you for everyone who joined us this morning. We kickstart the conversation with reps of the Ministry of Health and chit-chatting about where we are at this particular point in trying to get the coronavirus pandemic at a downward spiral for our country. So thank you so very much for joining us for that.
All right. And we want to say thank you to the Scouts Association for sharing with us what they're doing to celebrate their anniversary. And we want to thank Tim, who is still here cooking breadfruit for us because we all love breadfruit.
That's right.
And but more importantly, congratulations on your innovation in surviving the pandemic by creating a brand new business. And that is your specialty sauce. Absolutely delicious, and we definitely encourage you to try it.
Yep. So I'll tell you what we're going to do. We're going to lock things up because we've got some food to dip into. If you've got any questions, any concerns, drop us a line at oye@channel5belize.com.
You can also drop me a line at marlene_oye@channel5belize.com. Find us on Facebook at Open Your Eyes BZ.
You can find us on Instagram at OYEBelize.
And remember to tune in tomorrow morning at 6:30 when you open your eyes.
To start your morning right, as per usual, keep your eyes, your minds,
and your hearts open. We'll see you soon. Enjoy your day, Belize.
Catch it down to them called breadfruit. Watch it down, roast or fry, roast or fry. Catch it down, roast or fry, roast or fry. Breadfruit. You want breadfruit? Tell me if you want roast breadfruit. See it there? Now me applying a blade. Y'all come for the breadfruit limb. Chinga sing, everybody dancing. All gal too, me no do the man barring. Breadfruit a roast, everybody get around. Me shot said she love off the breadfruit zone. Too ching at when this trap. Breadfruit have a raised on a tone. Breadfruit. You want breadfruit? Just tell me if you want breadfruit. Breadfruit. You want breadfruit? Catch it down to them called breadfruit. Watch it down. Roast or fry, roast or fry. Catch it down. Roast or fry, roast or fry. Breadfruit.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.